Hi, I'm Dr. Bill Wyatt, and I'm a general dentist who has done nothing but orthodontics for nearly the last 45 years. Uh, I'm board certified in the American Orthodontic Society, and this is a group of dentists that are dedicated to teaching orthodontics to general and pediatric dentists. And it's one of the largest organizations of this type, and you can really learn orthodontics if you are interested in it. And we have a wonderful group of instructors in the American Orthodontic Society, and you can learn orthodontics from beginning to end, and really good orthodontics. So we're not interested in teaching a bunch of sloppy, quick stuff, but we do teach good orthodontics. And I appreciate you tuning in to this video. Today I'm going to try to cover something called oversized tongue. There's a lot of people that have tongues that are just too big for their mouth, and that sounds kind of silly, but there was an orthodontist from France that came over and worked here in Baylor for a few years that brought this out and showed how you could operate on tongues, just reduce some people's tongue and their teeth would come down correctly. His name was Andre Petit, and he showed one case for this lady's young lady. She was about 18, something like that. Her teeth were sticking out like mad and open, and he just reduced her tongue, just took a strip out of the center about an inch wide and about at least 3 inches long. It's just a huge piece of the tongue was removed and sewed this back together. It was a pretty hideous operation. I watched it on video, of course, up in Chicago, and came back, and of course I'm practicing here not too far from Baylor, but we had several patients that really I felt needed it, but only one that I ever actually did this operation on. So I'm going to show this case to you today. And he had, this is a young man, he had two major problems. He had two impacted teeth, and I'm going to ease over here into his slides and show you. This was just the first time. The guy was a swimmer, and he had a lot of problems with his skin. You can see the problems on his skin, and it really affected the way he looked. But he had this unusually large tongue, and he had all of his teeth in there except these two impactions, and he had space between all of the teeth. Each tooth had space around it, and really looked pretty bad. Now, when you look at the model, I don't have a real good picture of his tongue just laid out in front of us, but his tongue would just bulge out in this area and really pushed out against the teeth. Now I got his impacted teeth pulled down into place, all right, had everything, and I would pull his teeth together and they'd just go right back apart, and I just could not get his teeth to stay together. So it was a problem. I just really needed to get this done if he was going to get this to stay. And so they decided to go ahead and do this. And I got to find out this Andre Petit fella had gone back to France, so I didn't have him to lean on. I would have sent it over to Baylor to get him to operate on him, but he had gone back to France. But I got an ENT man in our area, and he got a hold of the old surgeon that used to do the surgery for Dr. Andre Petit, and he told him about how much tongue to remove and everything here, and we took more than you'd think. We took actually an inch strip of tongue that was at least 3 inches long back here and kind of tapered it together back, and then brought it, sewed it back together, and the guy's tongue grew back. And I remember the ENT fellow told me, says, I looked at it after we got through with it, and I thought, well, I didn't get enough. I didn't take enough off. So I'll show it to you, and we'll show. But we were able, after finishing this, to pull his teeth together to get them to stay. But it was pretty difficult even then. It was a pretty large tongue. You can see how it bulged the teeth out on both sides. And looking at the palate, doesn't look all that huge. We've done one other. We've got a second one of these cases, and it didn't need any surgery. It just we added teeth to that arch. We added some extra cuspid teeth to it, and it filled the mouth up. And you can see it too. You can go back and look at it. We've already recorded that one and have it ready to go. It's on the YouTube material right now. Now the lower, there's gaps in between everything, and he's got all the teeth he's supposed to have, and so we ended up having to reduce the tongue here, and still had some problems closing the teeth. Now I'm going to go through the impactions too on this case. He had two pretty badly impacted upper cuspid teeth. They're up in this area right in here, and we're going to show that in detail here. Here the teeth are with a panorex like this. These cuspid teeth are set right down in this area, and we're going to extract these deciduous teeth. Now I sent him into an oral surgeon to uncover these teeth. The oral surgeons, they go in and they really uncover. Now one of them uncovered, he ran into the crown of the upper lateral, which I don't like. I like to leave some tissue between that, but they touched that, and then we move those cuspids back out into this position here, and the palate looks pretty rough right at first, but you can take tissue out of the palate and it doesn't do the damage that it would if you took the tissue off of the labial or portion of the jaw. You just don't want to take any tissue off of that, but on the inside you can take the tissue off. So there the two teeth are, and that's what we took out. And you can see we put brackets on these and attached rubber bands, I think, and pulled them down to the lower arch, kind of that way. I'll show that to you in just a minute here. Alright, here we remove the deciduous teeth that the guy had in his mouth, and we went in and had the oral surgeon come in. Now I'm just going to show you some of where they took tissue out in here, but on this side they left a portion of tissue, which is, to my way of thinking, is much better. And over here they ran into the tooth and picked up over here where we had the extractions, and it came out. And this is not as good as this is, to leave some tissue between that. So if you're uncovering them yourself, you can come in and take tissue off like this. Personally, when I do them myself, I just like to go in and make a very conservative hold and bond my attachment on the tooth like that, rather than expose them as big as this is. Now, anyway, we got the cuspid teeth in, and we pushed these teeth together and opened up the space for the cuspids, and we just wore some elastics. We hooked them up back here, and then you kind of drag over here so that you get kind of a pull. Now this elastic kind of rubs over this, slips over this hook down here, and it kind of wears out. So you have to be careful. We have a much better method of doing that from this up and pull it to this point by a spring. If you go into the impacted teeth, it shows a much better mechanical way, but you can do this also on moving the teeth into the mouth with the impacted teeth like this. So we'll go through this. We're not trying to cover impactions all that much right now, but this will give you some idea. The more you look at it, if you do a few of them, you'll learn a lot more about this. Okay, we've bracketed everything. We've got the teeth on, pulled them all together, and we're pulling these cuspid teeth down into the mouth at this point. So we go ahead. Now, the tongue has not been reduced here. When we got the cuspids in place, we tried to squeeze these together, and they just kept opening back up. And this huge tongue in here, we just could not get the teeth to stay together like that. And so this is a legitimate operation, and you can check with this Baylor University, and Andre Petit, this French dentist, came over here and worked for a few years and did quite a few of these cases here in the Dallas area, but this was some time ago. Alright, so the tissue's healed up, but you see how much better this spot right here is compared with this spot. In other words, you're going to have a little bit of a pocket around that tooth on the, I guess that's the right side there. But anyway, tissue heals up much better in the roof of the mouth, or real good. Really, it's not too bad. And we can slide this tooth out, and you'll see the tissue will kind of have a little track going out there, but it heals back up quite well. Now, this is 1986, and there's the tongue is pretty big. You can't see it very much in there now. Same thing here. I'll just run through this. We'll just go as fast as we can here, and we're not too interested in that, but just how we sent him in to get the tongue reduced. Now his tongue is quite broad in here, and they came in, and actually the ENT guy told me, so I took a inch strip, at least 3 inches long, back of the mouth. You don't have any taste buds in this part, and when you close together, and it sews it up, and you taste just like virtually like you always did. And it's not a bad thing, but it's not something people like to do. I've had several patients that needed it, but never did decide to do that, and I can kind of understand that. So, but they suffer the rest of their life. They're just going to have spaces in between their teeth, or else you expand them and put extra teeth in, which is what we did in this one case. But she still had a kind of a caved in facial profile out there, even though we'd put an extra tooth in the upper arch in there. Okay, we'll go on from here. This is coming in good. The tooth is smooth now from here, about here, over to there. And we open these gaps up bigger than we need them a lot of times, and bring these teeth in. Then when you get them in and turn them around and kind of get their roots straightened out in here, then we close the space up in that area. Now, let me go back and get this. Okay, there's nothing right there that I need to cover. and we get the cuspid teeth down in line. Now you can see this is still not the reduced tongue. It's wide, it's big, but you can slim the tongue out, when you're taking pictures of it or something. But now this is 1987, and the operation on the tongue was done after this. Now we've got the cuspids in there. You see the little tissue problem there. You see it much better on this lateral over here. So if you have opportunity and you do this, don't run your surgical cut into this and pick up over here. Just stop down here somewhere, or try to. And that's what they did here. You see how much better the tissue is on that side than compared with the other side. And here is the tongue in 1987. You can see how it spread out like mad. And I got this ENT guy. He didn't really want to do this, but he had done a lot of work for me, and I knew him quite well. And he went ahead and said, "Well, I'll do it." But he wasn't real thrilled about it. He told me later, says, I took at least an inch wide strip, at least 3 inches or more long in there, and took that piece of tongue out of there and sewed that together. And we'll see, you can see the surgery here where this is healing up, and we pull that together. And there the tongue is in 1988. This is after I didn't see him for some time after the tongue was operated on. At least it had completely healed and the stitches were out when he came back. And that's the way the tongue looked. It had just a little scar down the middle, and you look at it, you can hardly tell it. And he could talk and do everything. His taste was about this, as far as I know, it was the same. And so it's really something. If you decided that you'd expand this and put extra teeth in here, some people would just be tremendously protrusive, and so you wouldn't want to do that. So the only other alternative here is to reduce the tongue, but it's not something people are thrilled to death about doing. But we've taken it down, and so that's the tongue that's been reduced, and that's all the scar that you see. And he told me, he said, after I got finished and got the stitches out, I thought, my gosh, I didn't take enough off of it. And he could have probably taken more. We were able to finally close the teeth, but I don't have a picture of the teeth fully closed. The space is fully closed in here. But you can see it's got a little bit of a point to it, and it sure didn't have that before. That thing looked like it was sticking out like that. This may not be something you want to do, but it's good to know that it can be done, and it's been done, and this has been done a lot. This guy Andre Petit put on seminars over it. I saw it in Chicago. It was a huge auditorium full of orthodontists and a few general dentists like myself and pedodontists seeing it. And it was a pretty gory looking operation, but anyway, it worked, and it works good. So if you decide to do that, you have my blessings. It is something that's good, and it works. If you reduce it, you can pull the teeth together, and I put a retainer on anyway to start with, but somewhere down the line you're going to have to take the retainer out, and if the tongue is just too doggone big and there's too much pressure in there, it'll create some space in there. The tongue has a lot of effect on the teeth. I did one lady, I ought to show her, she was 72 and she had had her tongue removed because of cancer. And she told me she was 72 when she came in, said, when I was 69 I had beautiful straight teeth and they took my tongue out and they didn't put something in there to support my teeth, and her teeth had collapsed in and gotten crooked and just messed up. In other words, they should have known they needed to put some type of retention on the teeth to keep the teeth in the shape they were in if they took the tongue away. So if your tongue, it doesn't have any pressure there at all, the teeth go in. If it has too much, they're going to go out sooner or later. So I'll go ahead and close this out now. And if you have opportunity to see that, maybe you'll at least know about it to some extent. This is the other lady, but I've got her stuff in another video. But she was too flat, you see. We didn't want, even after filling this in and putting extra teeth on both sides of the upper arch and bringing the lower around, bringing them forward, she's still straight facial profile. So in her case, you didn't want to do the tongue operation at all. Just go ahead and add teeth to an arch, and that's not a big deal. I can just, so you instead of 32 teeth, you end up with 34 teeth. So I'm going to close this now, and we'll draw it to an end here. Let me stop it.